Hey everyone, and welcome back to Recharging the Human Battery Radio Show. I'm your host, Dr. Stefano Sinicropi, and we are on AM 950 Radio. Thanks for joining us again today. Last episode was one of my favorites. We had Mandy Dickey, my co-host, who's not here with us today. You know, and we really got into some really interesting topics on how people can make the distinction between what is traditional medicine, what is holistic medicine, and putting it all together and not having biases one way or the other. Such a fun show. Hopefully you enjoyed that show. So this week, to follow up on that, I wanted to talk about the insurance problem that we have here in this country and how difficult it is to navigate both for patients and for providers. It is so confusing and somewhat bothersome. And so this last week, I actually did a post on social media that had so much engagement and really spurred a lot of other talking points, conversations. Love to hear what you have to say about it. But one of my concerns is that in the traditional medical world that I live in now, we are making treatment recommendations to patients based on the specific insurance coverage that they have. You can imagine this potentially could be quite troublesome. And so one of the things let's think about it this way. There are so many different insurance companies that people can choose to sign up to. There are the CMS providers, Medicare and Medicaid, and everybody has different rules, regulations. The handbooks are crazy if you look through these things. And as providers, we have trouble keeping up with all the different changes, what insurance companies are approving, what they're not approving. As patients, I can't even imagine how hard it is to make a determination on what you're covered for and what you're not. But the point is that when you come in to see your doctor or provider, whoever you're seeing, especially in the traditional world, again, that we live in, sometimes we need to take into consideration if what we are recommending is the best thing and is in your coverage in network for you, so that you don't have to pay out-of-pocket costs. Why is this a problem? It's a problem because if I, as a physician, have the knowledge and awareness that potentially a different treatment might be your best option or a less invasive option or something that I really think is going to make a difference, and I don't speak to you about that, having that knowledge, it can become a problem. However, if you think about it, we only have a certain amount of time together. When I say we, I mean the medical community as a collective. And so we have this short period of time together. Getting into the weeds and the details of what you're covered for, what we think we should refer you to, and everything like that can take a long period of time. And so sometimes these conversations are not had, and we just go the easy route, and you're just referred for whatever we think your insurance company is going to cover. So, for example, if it's a certain drug, you get that drug. If it's a certain procedure, you might get that procedure. If it's sending you to a certain doctor or other provider, it's that thing. And so this is just one of the things I want to dive into today. It's so fascinating. What else do you guys want to talk about? I know what you want to talk about, your copays, your deductibles, getting denied for procedures that your doctor wants you to have. I mean, we can go on ad nauseum as to how confusing the insurance industry has become. So in our time together, let's dissect through what I see to be major barriers with the way that the varied insurance company is currently administered, how I can help you to get over this, and how we can help you and your doctors or other providers to make decisions that are most beneficial to you. On that note, we'll see you on the other side of the break, and let's have a discussion about how we can help you to navigate the insurance problem. All right, folks, and welcome back to Recharging the Human Battery Show. I'm your host, Dr. Stefano Sinicropi, and we are on AM 950 radio. You know, the whole concept of the way that our insurance industry is run in the U.S. is so confusing, and it's something that I get asked about so frequently by patients who are absolutely frustrated trying to kind of navigate the whole thing. At Midwest Spine and Brain, we're doing spine surgery, brain surgery, high level complex things. I cannot tell you how much time we spend on issues of insurance, dealing with claim denials, trying to get things out, collecting data that they want, making sure we cross every T, dot every I, because otherwise patients get denied for things that they really need. We're always talking about delays in people getting approved for certain procedures, but also just delays in just minutia. And it's very frustrating. And there's just so many different issues to talk about when we talk about how we as doctors can do a better job helping you guys navigate through the insurance mess, but also really helping you to understand what are your policies? What are you covered for? Where should you be putting your dollars? Because as you know, your deductibles and copays are really going through the roof. So how do you differentiate? Is this a good value for me? Is this not a good value for me? Is this something, that I should be looking at? How do you deal with, denials when your doctor says you need to be on this medicine or you need to get this procedure? You want to think a little bit out of the box and you get denied for that thing. Like, what are you supposed to do as a patient? People are really lost. They're struggling. I cannot tell you how many times I have these conversations with my patients and on my clinic days, not to mention the number of complaints coming in. And so much of it is related to things that people are struggling, trying to figure out with their insurance, trying to get their procedure done, being in a lot of pain, not being able to get where they need to, to get. Not only do they have to deal then with the doctor's offices, but if they're sent for some kind of a procedure, then they have to deal with the hospitals or the surgery centers or wherever they're going and dealing with their entire insurance authorization, because there are two facets to insurance that from the kind of the provider side, from the hospital side. So there's something called the professional fee. So whoever the provider or doctor you're seeing, they are billing for a service or a fee, right? And that is seeing them in the office and or them doing a procedure on you. On the other hand, whatever facility you go to, they're dealing with a facility fee. And these are different. And there's different things that go into authorizing these two things and making sure that, the providers, the hospitals get paid, but also really making sure that you as a patient don't get stuck with something where you feel like you were approved for it or you felt like you were in network and then you ended up being out of network. You see where we're going here, right? I've been speaking for a couple of minutes and already we're opening up Pandora's box of a rabbit hole. And this is my world. This is what I deal with. So, I thought that based on you guys being so interested in just me talking about how insurance may influence actually what you are even being referred for, made such a, it was so interesting just to see what your responses were on that. I thought we really needed to spend more time together to discuss these issues a little bit more. So let's just go through some of the problems that I see with the whole concept of insurance and how it's really clouding everything right now, right? If we had a universal healthcare system and you just were approved for everything and whatever the physicians or providers or nurses or whoever ordered, you got, and there was no paperwork, there was nothing to do, then it would be a world that's easy for you. You come in, you decide after doing your own research, okay, I want this, I agree with my physician that this is best for me, you just have it. Unfortunately, it doesn't work that way. So let's talk about some of the major points that really I'd love for you to kind of have take home on, understand, and we can go into this on later, shows when I have my co-host Mandy. We can talk about it further. And I'd love to hear your comments. Please leave your comments in the comments section, especially if you're watching this in the podcast version. So the first thing we'll talk about is insurance only covers certain things. Now, sometimes it makes a lot of sense, right? There are certain things that are always going to be covered, right? There are other things that some insurances will cover and some won't. So, for example, in my world of spine surgery, certain insurances will cover certain procedures like total disc replacement, and certain ones may not. Some will cover a 2-level disc replacement surgery, which is FDA approved for 2 levels. Some still may not. Sometimes insurance companies want us to do things where we disagree with them, right? And that's why the reason for the denial. But that being said, here's the problem. The problem is, as a provider, we have unfortunately had to become experts, okay, at least in my world, at what insurance is going to cover what. Because if I say to a patient, hey, I want to do a disc replacement on you for an L4-5 disc herniation that you've been dealing with for a long time, you've got back pain, I mean, all the right indications for it. Okay, we're not going to get into specifics of exact indications for it, but things that were in the bucket of what the FDA eventually approved these things for. But I know that your insurance company doesn't cover that procedure, right? Where does that leave me as a doctor? Do I recommend the procedure that I know that you can't have? And the vast, vast majority of people are not going to be able to pay for these things out of pocket, because it may bankrupt them, right? So what do? Do I say, hey, you should have this procedure, but I'm really sorry, I'm going to do this other procedure because your insurance company doesn't carry it, and that's all I have, even though we have this better data that we can help you with a disc replacement surgery? Or do I try to take the easy road and just recommend what I know your insurance company is going to cover? So, for example, I might say, hey, let's do a back fusion on you. But in that case, right, I think a disc replacement, even though I think a back fusion might work, because obviously as providers, we're not going to do anything that is not going to help you. But maybe I don't talk to you about the better technology because you can't have it, right? That's a problem. Same thing with medications, right? If you see your endocrinologist, if you see your diabetes specialist, what if they are aware of something that is more beneficial, but they know that you can't, that it's not going to be covered, and they know you can't afford it? So again, number one, how much time do they have to even sit there and have all these huge level discussions about what insurance covers, whatever? Let's compare the data on these 2 drugs, and unfortunately we can approve you for this, but we can't for that. Where does this leave the doctor? It really is a very difficult predicament. Okay, I know how I do it in my practice. I just say it like it is, and I try to say, listen, in an ideal world, we would do this, but at this time, we'll do this, and then give them the option. Hey, if it's not an emergency, obviously, hey, do you want to wait until this is approved, or do we want to go through an appeal process that may take 6 months? Because I know they're going to deny you 2 times, and then you have to do all these other things. Again, depends on the insurance company. Everybody has a different appeal process. That's a whole other problem. Or do we do this other procedure that, yes, maybe the month after you're going to feel a lot better, but then in 5 years down the road, you're more likely to need another surgery. Then what does the patient then do with that information? Right now they're going into a procedure knowing I'm doing something that is FDA approved. I'm doing something that is absolutely still considered gold standard, but I'm not doing what their doctor, who they come to for their advice, feels is the absolute best thing that we can do for them, okay? Same thing when we want to recommend them for things that you guys know are near and dear to my heart, right? As also a holistic and wellness expert, right? I would love to refer people for laser therapies and photobiomodulation, light therapies, and all these other things. Okay. And I do it, right? And obviously we have other ventures where we're promoting these things and it's tremendous data and science behind them. But yet I'm also aware that these are things that are not covered by their insurance, along with other modalities, which I'm a big believer in, right? My style is to just offer it to them and just let them know, even if I know that they cannot afford it or they can't, just to make them aware so that they can try to figure out a way to get into those particular, modalities. No different than the same thing, like with the surgeries. At least if they know that maybe disc replacement or some other motion sparing thing or an endoscopic spine surgery that I know another doc in town might do and might benefit them in that, predicament. At least if we're providing information to people and just saying, hey, I think you'll benefit from this. Insurance doesn't cover it. What do you want to do? Same thing with stem cell therapies. And there is so much that we can get into, but I just wanted to put this on your radar. Again, let's get into what our surveys show. In 2017, a survey found 78% of physicians reported insurance coverage issues often or sometimes influence their treatment decisions. Okay? Let's take that to heart. That's 80%. 4 out of 5 visits may be influenced by what your insurance company carries. That is not a good way to do things. We need to get away for treating patients to what the patient's insurance company covers, especially when it's non-urgent, non-life-threatening issues, okay? That's one topic. Again, we can talk about that the whole time, but there's so many other topics in the insurance world that we just need to talk about. The next one, which is a huge pet peeve of mine and something that spurs a lot of upset, anger, both amongst the medical community and among patients, are what we consider to be unjustified insurance claim denials. This is a big problem. And you guys have to understand, there is so much paid attention to what's denied and what's not denied. There are these AI programs now that are making decisions for your life. Okay? You may not be even aware of this. Okay, AI programs have biases. They're not perfect. And so you've got on one side AI programs trying to really narrow what people are justified to get, right? Because they're trying to help, bolster profits or whatever. Okay, that's fine. We live in a free country. People can, be profit driven. That's okay as long as you are getting what you need. On the flip side, interestingly enough, if you look at hospital systems, they are also employing AI-based programs to counteract the other AIs that are trying to deny things. I mean, these are things that most people have no idea what's going on, and then when they get that denial letter, they're in shock. They don't know what's going on, right? So then they come to my office with their denial letter, tears rolling down their eyes, and I have to stare at it, and I have to tell you, some of the denials that we're seeing it's outrageous. It's outrageous, right? This week, I saw a very nice lady, very fit, 44 years old. She is Miss Holistic, has tried everything. She's also Miss Medical, has tried everything. She's had injections. She's had therapy. She's had every single thing that we ask people to do in a situation where they've got a bad disc and even would be a good candidate for disc replacement. I will tell you, if I took her MRI scan and posted it up, she is the poster child for disc replacement surgery. Poster child. She is everything. That is the exact patient that was utilized in the studies done, again, to get these things FDA approved. She's done everything. Every single thing. And she herself didn't want to have surgery, but then came to the realization she wants surgery. We put her in for disc replacement surgery. She's now been denied 2 times for this surgery. This is a completely unjustified denial. And guess what? There was a suggestion that I should do a discectomy on this patient. She doesn't have a disc herniation. It's preposterous. I don't even know who's making these recommendations. Is it the AI? Is it some person? Is it a veterinarian? I have no idea, right? But we are swimming uphill. We are fighting an uphill battle with insurance claims. I could tell you, I sit in the doctor's lounge all the time, and I feel so bad for some of my colleagues. I hear the infectious disease guys. I hear all these other people trying to get drugs approved that they believe are life-saving for the patient, or they may be thinking out of the box because something's not working and they need something else. They're literally trapped on the phone for hours trying to get a hold of somebody to get something approved for their patient, okay? And kudos to them, because I think, physicians are incredible advocates for their patients. I mean, they bleed this stuff, right? They want to help, right? They're heartbroken when things are not approved that should be justified, right? But yet, this is what we're doing. This is absolutely what we're doing. And it's got to change, okay? Some of the denials are eventually overturned on appeal, but think about the suffering sometimes that happens when people are in severe pain or they're sick and they need something very specific, and it's denial after denial, appeal after appeal. You know what? That 3, 4, 5 month window when they're waiting for all these appeals and everything else to go on, what's their quality of life like? Are they missing work? Can they put food on the table for their families, right? Are they such severe pain that now they're having a pain medication problem, right? Which is a whole other, topic that we're going to cover ad nauseum on this radio show, because it's something that needs to be out there, and we need to be talking about it. What happens in this time period? These are not numbers. These are people. These are human beings. How did we get here? We just need to be able to do what we need to be able to do, right? And the vast, vast majority of physicians, I'm an insider, I talk to people all the time, are these guys, physicians, nurse practitioners, anybody that is making recommendations, absolutely the vast majority are trying to do the right thing for the patient. So insurance companies turning around, trying to say that there's too much stuff being done and you shouldn't do this and you shouldn't do that, that is not their role. That's not what they're there for. They're there to support you when you are in need. You pay premiums, they need to be supporting you, okay? So those of us that are passionate about this will be lobbying for you, will be doing these other things, but it's really going to take a collective effort of the medical community. And I can't tell you how many physicians, nurse practitioners, nurses, physical therapists, chiropractors, all these people are out here fighting for you to get things covered that are in your best interest, right? And they need your support. So, please support them as we go down that route. So again, a whole other topic. We'll cover it on another show. I'm just trying to get you thinking about what are the major issues that we need to fix, in the insurance world. Okay. This one, I know this is really very, very much at the top of your guys' minds, because I get asked this all the time, right? Rising insurance costs for consumers. Insurance premiums are out of control. I don't have any other words, to use. Okay, listen to this statistic. This is crazy. Between 1999 and 2021, family insurance premiums increased by 324%. 324%. For those of you that have been working from 1999 through through now, how many of you have 324% increases in your salaries, in your take-home pay? Have you had? Where are you getting this money from? I mean, have your kids' schools, are they charging you less? Right? Is daycare less? No. So how are we going to continue? And I can tell you, as a business owner, our insurance premiums that we pay for our employees are insane. It is out of control. I mean, some of the numbers that we see are staggering. It's unbelievable what's happening, and we've got to absolutely do something about it. Let's talk about deductibles. They've skyrocketed, right? 68% increase in single coverage deductibles from 2011 through 2020, so in a 10-year period. Right? How many of you report that you just are having trouble with just your out-of-pocket medical expenses. Now, it's 46%, but I've got an even better question for you. Where are your dollars going, right? And so you're paying this money if you are not even maybe seeking your medical care at the places that can help you the best. And again, this is a whole other conversation on what is best. And again, doing your own research before you start seeking medical care is so, so important, and I urge you to do that. But the problem is that not only are you struggling to pay the bills, but sometimes the care that you're getting, whether it be in the traditional system or holistic care or whatever it is, as far as keeping your health better and getting your quality of life and your well-being, if it's not spent in the right place, then not only are you in the hole, but you're in the hole and you haven't even gotten potentially the right care. It's such a huge problem. And we talked about this a little bit on the last show, how important it is to get the most value out of your care. So something might be more out of pocket. It might be fully cash, but it might give you the best benefit over paying, right? Overpaying a copay or, reaching into whatever your deductibles are for something that, yeah, it's traditional, but it's not going to help you. Again, outside of the scope, these are just things that are food for thought, because I want to hear what you guys think about this. I want to hear how much are rising insurance costs hurting you. What's going on? Once I hear these comments, I can do shows entirely based on maybe one or two or 10 of your comments, whatever that might be. Now let's go back to you as the consumer. On top of the fact that your premiums are skyrocketing, right? You as the consumer are being forced into narrower and narrower networks. Here is my problem with narrow networks. I understand that people are trying to save money, and we're trying to, make sure that, insurance companies stay viable, which I don't think they have a problem with. That's a whole other topic. But they want to narrow your network, okay? Now, one of the big ethical considerations with narrowing your network is what providers are they actually putting in your network? Are they the best providers, or are they just the lowest cost to that insurance provider? That's a big deal, because you need to know what you're paying for. You're paying dollars, right? So if you're forced into a narrow network, but you think, Dr. R or Dr. X is going to give you the best care, then that might not be a great, maybe you're saving because you're in a narrow network and the insurance company is saving, but guess what? Dr. X, who's the best doctor at this, is excluded from that network. That's a big problem. And sometimes people are shocked to see who's in and out of the network. And then some of them are so wanting to see that particular doctor, they end up going anyway because they feel that they need the best care, not dictated by the insurer, but the best care, right? And so they'll end up going to that Dr. X, and the bills can be really, really stressful and straining on their thing. Some people sell things to get certain procedures from doctors. I would not recommend that. I would recommend at least getting some other opinions for people that are in your network and seeing if we can come to some kind of happy medium, because ultimately, right, we always talk about health is wealth. Well, if you lose all your wealth, your health is going to be compromised too. It's a two-way street. So again, I'm happy to answer any of your questions when it comes to narrow networks and how that all works. But again, we need to be really careful about narrowing these networks based on the cost that the provider is costing the system, if they're great and they're providing the best care for the patient. So we got to be really, really cautious on that. Same thing about narrowing your network to certain services. It's the same thing that you might be narrowing yourself out of having the best service. And so, maybe that service is somewhat more expensive, but it's going to actually help you with your fibromyalgia or your chronic disease or your diabetes or whatever. Again, we're not giving very specific examples. The role of this show is not to give specific medical advice, but just to raise questions and concerns that are so important that we need to answer together as a medical community, as a holistic community, as a patient community, and make decisions and really lobby and make changes that are necessary to really, help us to make the right decisions, okay? Another thing that is going to, spur a lot of conversation and something we talk about all the time, gosh, how complex and confusing are some of these insurance plans. I'm a physician and I read some of the insurance plans and I have to triple read it because I don't even know what's going on. I don't even know what the patient is, even what they're covered for. We have an entire department in an organization to make sure that we get bullet points on each different individual insurance company, what they cover, what they require, what their pre-requirements are to get X, what their pre-requirements are to get MRI, which is different from the other company. If I'm having a hard time, okay, and the reason I understand it all, because I have a great team that does all this stuff to me. I'm sure you guys don't have a huge team to go through your thing. I mean, your team might be your son or your daughter or your mom or your dad, whatever it is. That's a different team than we have. You don't have a team of experts who literally went to school for this stuff and understand the insurance industry. That's where we are right now. So it needs to be less confusing, and I'm hoping that legislation comes down the pipe that just makes it a lot easier, okay? That just spells it out, so that there's not these just complete surprises to patients, because guess who hears it? Me, because I'm actually going to listen to them, right? Good luck calling your insurance company and trying to have a 35-minute conversation about, I mean, come on. I mean, what are they going to, they don't have anything to say, right? They're just going to say, you're denied, you're not covered for this. Read the letter, right? And so we need to make really important changes here coming down, the road. We could talk about other things like lack of price transparency and different motivations and other things that tie into it. But what I don't want to do is get into really like the deep weeds of this whole entire conversation, because then you're going to leave this radio show and say, you know what? We were onto something, and then that guy kept going down this crazy, confusing path. Now I'm more confused. I don't even know what to do. Maybe I'm just not going to leave my house. I'm too confused. I'm in a total state. I'm tied into a pretzel. I can't do anything. So I really want to talk about these issues for you so you help to navigate the system. But I can't talk about this stuff without then going back to the frustration that physicians and other providers that are providing services for patients have on this. And insurance coverage issues is a huge, huge piece of it, okay? And so let's talk about that part of it. One of the number one drivers of doctors, nurse practitioners, chiropractors, other holistic, specialists, just kind of our entire medical industry. What is one of our biggest things? The lack of autonomy, the loss of autonomy. So we're not going to get into things like employed physicians and feeling like they are just being told what to do. They're just cogs in this wheel, right? I want to talk about how does this whole insurance thing, right? We've talked about all these other insurance issues, right? Why is it depressing for physicians? Okay, here's why it's depressing. We went to school for a long time. Okay, I'll just give myself as an example. 4 years of med school, right? Then I did a research year, and then I did another 5 years of residency, and then another year of a fellowship, okay? That's a lot of years, okay? I was young. Those are some of the best years of our lives, okay? Didn't sleep much. We talk about this all the time. Did all of this stuff, then to come out excited. Okay, I'm telling you, when we're done with school, no matter what professional school you deal with, if you want to help people, you are excited, right? You get your white coat on or whatever you do in your industry, and you take your oath, and you are fired up, right? I have goosebumps right now thinking about the white coat ceremony and when they put that on me and when they were about to call me doctor, right? Now you come out and you talk to your patients, and you want to help them. And all of a sudden, barrier after barrier. And you think to yourself, wait a minute, I just studied for a decade plus. I have all this knowledge. I'm an expert at this particular thing that I do. I want to recommend something to you, but I can't. Or you can't afford it. or, I don't even know if I should tell you about it, because then you're going to want it, but you can't have it. In any other way, because some of these things that we recommend, obviously, you can't pay for cash. We're not talking about some holistic things that are more affordable. We're talking about surgeries and certain medications and things like that, right? How many news articles and news stories do you see on your local news about, people sometimes going into bankruptcy because of some health thing they had and they weren't covered and they didn't know? It's a mess. But on the provider side, we get so frustrated because we want to do what we think is best for you, and we are hampered. But we also know that we have to spend a lot of our time getting you guys authorized for these things, right? I mean, we have a very big clinic, so we have a lot of help as physicians, but in smaller clinics and in certain situations where docs and nurse practitioners and whoever else is providing care for patients, they have to do a lot of this stuff on their own. You know how frustrating it is to have to stay on hold for 47 minutes before somebody comes on the phone so I can argue with them about a procedure that I am positive is going to help them. I can call 10 other spine surgeons who would say, absolutely, this patient needs surgery. And I have to argue with somebody that's like, no, this line 89.1376. We don't cover this procedure by that. And then we make our case. And at the end of it, they say, you know what? I think that the patient probably should have it, but I can't authorize it because this line says I can't authorize it and my hands are tied, right? What does that do? That takes my autonomy away. I'm just talking. I'm just saying stuff, just to say it, okay? However, I'm still always going to tell my patients what I believe is best for them, regardless of what's covered, what's not covered, and make it and have an honest conversation, and then they can make the decision. But it is frustrating. Loss of autonomy is so frustrating for us as providers, and this whole insurance mess is a big part of it. So what was my post this week that I teased in the first segment? What did I say? And here's what I said. I said, I don't remember when I went to medical school that the doctor-patient relationship was a three-way conversation. I thought it was a two-way conversation between myself and the people in front of me and their families and so on, right? But it's still me and the patient making a decision on what's best for them. I didn't realize it was a three-way conversation between me, the patient, and whatever the insurance company wants. That wasn't really a realization. And it spurred a lot of discussion, okay, especially amongst the medical community, and it's frustrating. We're frustrated by it. You're frustrated by it. We need to make changes. But the best change, the way I can help you guys, and what I really wanted to get out in this conversation is at least you need to be educated on what's going on behind the scenes, because then at least when you go to your visits, you see your specialists, you see your primary care providers, you see your holistic providers, you already understand some of these issues. And so you're not shocked, you're not surprised. You can have a more educated conversation with your providers and figure out, how am I going to do this? How am I going to get this procedure? How am I going to get the best care? What do I need to do? How do I navigate these issues? So education is paramount. We need to educate ourselves. I need to educate you guys. I'm excited to have you guys on the show. This is a topic that we're going to be talking about more and more, and I'm sure it'll be weaved into other shows, because in the American system, the insurance process is so important in every way. And again, insurance companies can be very helpful. They provide, the money, the dollars, so that you can get the things. But it has to be done in a more transparent, open way, with less sticker shock, less surprise, less denials, less frustration. So let's work on this together. We'll go out there, we'll lobby, we'll do what we need to do. But if you're educated, I think this can help you so much in understanding what the process is, decrease your frustrations, and let you be a more active participant in your own care. On that note, we're going to take a little break. We'll see you on the other side. I hope this has been really eye-opening for you. We're on AM 950 radio, and we'll see you in a minute. Okay, welcome to the last segment here of our show. I wish our time together did not have to end. This is Recharging the Human Battery. I'm your host, Dr. Stefano Sinicropi. We are on AM 950 radio. Well, the insurance question is confusing. We've got to come up with better options, but the number one thing I wanted to get out of the show today is really to empower you through education. If you understand your insurance coverage, review your policy, know your benefits, understand if you're in narrow networks, it's going to be a great way for you to really be able to maximize your use of the premiums that you are paying for your health. So, main points. I'd love for you guys really to advocate for yourself. If you face a struggle or a denial to access care, don't give up. Don't give up. Work with your provider to try to get the particular thing approved. Appeal the decisions. I know sometimes it is going to take work on your part as well, but appeal those decisions, especially if your provider is absolutely emphatic that this is the best thing for you. The other thing is seek second opinions. One of the things that I found in my work as a spine surgeon is that sometimes when patients get denied, I'll get them out to really competent, capable second, third, fourth opinions. And when we're all saying the same things, sometimes we're able to vault over the previous denials and they're able to have their procedure. Even if they're not able to have it with me in my clinic, maybe they'll have it somewhere else. As long as they're with somebody that's going to take care of them and do a good job, that makes me happy, and that gives me so much satisfaction as a physician that really wants to help to heal and get you guys better. We need to support systemic change. Listen, individual action is super important, and this is going to really help us, but together, collectively, we need to be out here lobbying for change in healthcare policies. Go out there, contact your reps. The more that you contact your local representatives, your state representatives, support initiatives on transparency, on reducing costs, on being fair, the better we are going to be able to get a world where you get the care that you actually absolutely need. Have these discussions with your doctors and your providers, right? If you're frustrated, don't feel, embarrassed, or, if you're angry about it, let us know. I love when, people talk to me about it. Most of the time I spend my time commiserating with them and being understanding. I understand how frustrating it is. But the more you make your case to the provider, the more you're going to inspire them. You're going to, tug on their heartstrings to go even further, even go that extra mile to get you approved for, that procedure or that medication or that, holistic care or whatever it is, that you actually, need. And finally, as far as doing your own research, again, I'm giving you more things to do, but really stay vigilant and educated on what's going on with the insurance system, how it all works, with hospital systems, with doctor, with different, organizations, with different care. I know this is a lot. But again, the more educated you are in anything in your life, the more likely it is that you're going to succeed in whatever you're seeking. And in this case, we're talking about succeeding in improving your health, your well-being, right? And so the more you know about how the system works, the more you can access it. It's no different than your first day in Congress. That's going to be very different than when you're serving your fourth term. You know where to go, who to talk to, what to do, what the latest is. So educate yourselves as much as you can. Do your own research, and I know you're going to do better navigating this insurance world. Our time is up today. It's been a blast. I hope this really helped you today. Again, please, please, please leave your messages in the comment section, because I want to know what you think. I want to use this for fuel for further episodes. And remember, your health is your wealth, and let's treat it that way. Until next time, I'm your host, Dr. Stefano Sinicropi. We're on AM 950 radio, and we'll see you next week.